Consilia Kerubo, and I'm going to talk about the contribution of capacity building on quality healthcare service delivery. So going to the outline, we have motivation, and then we have problem statement, hypothesis and objective, population, sample size, and then the sampling strategy, presentation of key findings, problem identified and practical solution, contribution of the skills acquired to the research process, research conclusion, and recommendation. And so motivation. So what motivated me like to do this kind of research and this topic is about the changes which can improve service delivery in hospitals, because we have I have for the Ololunga District Hospital, I saw that the kind of service delivery which is over there is not good. So I saw like doing like what are some of the changes which can be improved so that the patients can get high quality service delivery services. And then the quest to know the challenges of adopting digital machines in hospitals, like wanting to know like the kind of challenges or the kind of problems in which affects like the digital machines from being adopted to the hospitals, like the kind of things which can hinder the digital machines from being taken or from being adopted to the hospital. And then the success of healthcare digital machines in other countries, like we can base on countries like the United States of America, where we have digital machines in most of the hospitals, and how they have like how they offer the services compared to the hospitals here in Kenya, which don't have the digital machines. And then we have the problem statement. So the problem statement is that improved healthcare service delivery in Ololunga District Hospital is the result of good technology systems and availability of power supply in the hospital. So this means that if we have good technology, good digital machines in the hospital, it means that the kind of service delivery which is going to be over there is very good. So it will give high quality services when we have good technology and when we have stable power supply. So it's going to make like the delivery of healthcare services to be of high quality. And then we have the hypothesis and the objectives. The hypothesis was improved healthcare service delivery is the result of good technology system in the Ololunga District Hospital. So quality healthcare service delivery is the result of good technology system. So if we have good technology systems, good digital machines, it's going to improve the quality of delivery of healthcare services. The general objective is to examine how capacity building has aided in the delivery of high quality healthcare services. And then we have the specific objective. The specific objective, the first one, is to identify the benefits of frequent training to healthcare providers in providing high quality services to the patients. So like how the trainings, how the knowledge and skills that the healthcare providers are getting more frequently, like always more often, are going to promote in provision of high quality services to the patients. And then the next one is to analyze the advantages and the disadvantages of modern technology in the delivery of healthcare services. So we are going to look at the two sides. We have the advantages and we have the disadvantages. So there is no system, there's nothing which has only advantages. We have to base on if this machine has more advantages or if it has more disadvantages. We are going to look at that so that we can see like the kind of a machine which can offer more advantages compared to the disadvantages. And then we have to assess the knowledge and skills of healthcare providers in provision of healthcare services. So we are going to assess like the kind of knowledge and skills the healthcare providers have when they are delivering the services to the patients. So we also have the population, sample size, and then the sampling strategy. We have the target population was 60 people comprising of 30 employees and 30 customers. So 30 employees and 30 customers sum up, they come with a target population of 60 people. And then for the sample size after calculation, it was 53. I got 53 after calculating the sample size. So the sampling strategy, it is stratified sampling, which was used because it divides people into groups based on their characteristics. So this strategy it divides people according to their characteristics. So we are going to see the presentation of the key findings from the patients or from the consumers or the customers. We consider that the first question was, how long do you wait to be served when you come to hospital? 86.5% said they take a lot of time to wait to be served in the hospital. 11.5% say they wait for 30 minutes to be served in the hospital. And then the 2% say that they wait for 10 minutes to be served in the hospital. So according to this information gotten by the researcher, it shows that 86.5% of people, like most people, take a lot of time in the hospital waiting to be served. So we can see most people take a lot of time to be served in the hospital. So they take a lot of their time there. So they consume a lot of time waiting to be given the services by the healthcare providers. We also have another information like how often does the healthcare providers use electronic health records? 61.5% says sometimes they use e-health, 15.4% says often use the e-health, 9.6% said more often use e-health, 13.5% said never use e-health. So we can see that majority of the people say that sometimes they use the electronic health record system. So this means that the kind of services they offer, like when they're using these electronic health records, they don't use it always, they sometimes use it. So if they sometimes use it, it means that some people get the services using the electronic health record and others they don't get that service. So the healthcare providers should improve, like they should use this electronic health record more often. Then we have like how often do you incur slow service delivery in Ololunga District Hospital? 67.3% they said more often, 32.7% said often. This information gotten by the researcher shows that like people, like most of the consumers, most of the customers, they incur slow service delivery in this hospital. So this means that if we don't have like the digital machines which can like hasten, which can make it easier for the patients to get the service delivery very fast, they are going to continue incurring slow service delivery, which is going to even make even the patients to prefer to go even to the private hospitals. And then we have the findings here from doctors and nurses. We can say that the information is that is the availability of digital technology machines one way of getting high quality service at Ololunga District Hospital? 86% said yes, 0.2 said no, 11.5 said maybe. So we can say that most people prefer using digital machines so that they can give high quality services to the patients. So if we have this technology being adopted to the hospital, it means that the patients are going to get high service delivery. They are going to get high quality service delivery. They are going to incur slow service delivery. They are going to, no, they are not going to consume a lot of time in hospitals. And then we have findings from doctors in nurses also. They all say the information gotten by the researcher shows that frequent training to the healthcare workers help in providing high quality services. So if the healthcare workers continue getting more frequent trainings. It means that they are going to offer high quality services to the end consumers or to the customers. So it is good if they get, or if they use these trainings, if they give more trainings, frequent trainings to the healthcare provider so that they can enhance their skills and knowledge. And then we have healthcare workers need to use digital machines to ease their work. So the digital machines make the work very fast. So if the healthcare workers get these digital machines, they are going to ease in their work. Even retrieving the information of the patient will be very easy. So it will be very easy for them to get the information and to work very fast so that even the patient cannot incur slow service delivery. And then the last one is using digital machines more frequently will improve their skills. Yes, this is true. The moment the healthcare workers continue using the digital machines, the more often they are going to get them more knowledge and skills on the way of getting it, or even the way they are going to offer like some other, they will even be able to learn more new things so that they can offer high quality services to the patients. And then we have problem identified and then the practical solution. We say that the problem identified is power outages and poor internet connection. So the problem identified and the practical solution: to cap the challenge of power outage, an electric generator should be purchased. An electric generator should be purchased because it will listen, like when the power goes off, they are going to use the electric generator to continue offering the services instead of waiting for the power to come back. And then for the internet connection, the service provider should invest in networks like Safaricom so that they can get a 5G network, which is so fast, which can offer the services more easily and so fast so that they don't incur slow service delivery. And then the contribution of the skills acquired to the research process, the communication skills. I learned the communication skills at Kepler, even from the CFA project. You have to communicate ahead of time. Like when you have, like when I was going to do the research, I had to communicate with the head of the hospital, like I'm coming to your hospital, I'm requesting for your consent so that I can conduct my research in your hospital. So that's how you are supposed to communicate, communicating ahead of time. Communication helped me, like even when talking to the patients and even to the healthcare providers, I had to communicate with them in a language which they're able to understand, in a convincing language so that you can get the information that you want. I also had the collaboration skills, like collaboration skills, how you collaborate with the people you are working with, like the head of the hospital, the patient, the healthcare providers, how you collaborate with them well so that you can get the information that you want. Also learn about the data collection skills. The data collection skills help me in the field. This is because I was able to collect the data, the right data that I wanted from the in the research I was doing. So I was able to come up with that data because I had the data collection skills and from the foundation year, from the CFA projects. So it helped me. I also had the interviewing skills, like how you are supposed to conduct an interview, how you are supposed to request for consent before doing an interview with somebody. So this is something which we learned at Kepler and which has helped me in doing my research. Also, the last one is planning skills. Planning skills is how I planned myself. Like I remember in foundation year, we had to plan when we were doing the final assessment. Like when you have to plan, like this person, this group is going to collect the data, this group is going to do this and this. So you have to plan yourself before doing the actual thing that you wanted to do. So planning skill helped me a lot. And then the research conclusion and recommendation. From the conclusion is that using modern means of technology in a healthcare organization can help in promoting high quality in the delivery of healthcare services. If you use modern technology in a healthcare organization, it's going to help in delivering high quality services. Then the recommendation is that the Minister of Health, Mutahi Kagwe, should put more emphasis in providing digital machines to the hospital. So thank you. That's all about my information.